Hi, my name's Ariana. I'm going to be your nurse today.
I've waited for like an hour.
I'm sorry about that. Sometimes the hospital is slow. Hey, I see some blood on your head. What brings you to the hospital today?
Okay, I got in like this boss ass fight and I beat the bitch up, but she got me and I got knocked down and started bleeding. And I got dizzy, so I came here because all my girls were telling me to, and now I'm wasting my time.
Okay, I'm just going to do a quick assessment of everything. So I'm going to start off by asking you a few questions. So what is your name?
Alyssa,
Thanks. And what's the year?
2014.
And where are you right now?
The hospital.
And do you know why you're here?
Yes.
Can you tell me why, please?
I got in a fight.
Okay, thanks. We just have to ask these questions. It's just policy. So now I'm going to look at your pupils with this light. So if you could focus on the wall over there, just look straight ahead. I'm just going to come in from the side and shine the light in your eyes. Okay, and so your pupils are constricting normally to the light, which is a good sign. Now I'm going to take your blood pressure. You don't have any open wounds or anything on this side. You haven't had a mastectomy or dialysis fistula, anything like that? No? Okay. So if you could just put your arm out like that. Thank you. So just take a second. Okay.
So, got any kids?
No, too busy.
Shame.
Yep. Okay, so your blood pressure is 110/70, which is good. That's normal.
Hold on, I'm gonna take a selfie.
That's great. Okay, so I'm going to listen to your heart sounds now. So just breathe normally for this. And if you could lift up your breast on either side while I listen. Thank you. And on the other side too. Thanks. Okay, so your heart sounds normal as well. I'm just going to take your pulse right now. So you just, put your arm out like that. Okay, so your pulse is 70 beats per minute, which is also normal. So everything looks good. So I'm just going to ask you some more questions. Do you have any previous medical conditions?
I take this medication.
Do you know what it does or what the name of it is or anything?
Starts with C. Coumadin?
Oh, yeah. So actually, according to your chart, it looks like you have high cholesterol, so that would be Coumadin, right? Does that sound familiar? Okay, so do you know how much you're taking by chance? Okay.
I get it at Long's drugstore.
Okay, that's good. I'll call the pharmacy and ask. So yeah, I'll be right back. I'm gonna come get some supplies and I'm gonna dress the wound on your head. I'll be right back. So here's your call light. So just press that if you need anything from me, and I'll be right back. Okay?
Okay.
Sounds good.
Wasting my time.
Hi, coming in again.
Hey.
Hi, I'm back. I'm here to dress your wound. I see you're still bleeding over your head. How are you feeling?
I feel like shit.
Can you tell me more about that?
My head really
Do you feel nauseous at all or dizzy? Dizzy. Okay, can I help you to a sitting position?
I don't want to sit.
Okay, I'm just going to take your pulse and take your blood pressure real quick, see if anything's changed.
What's happening to me?
Okay, your pulse is a little bit low. I'm gonna take your blood pressure now. Put your arm out like this. Okay, your blood pressure is a little bit high now. I am going to call the doctor. But in the meantime, I'm just gonna check your pupils again. Is that okay with you? I'm just gonna check your pupils again, so just look straight.
Who are you?
I'm your nurse. I'm here to take care of you. Just look up like that. Okay, so if your pupils aren't reacting now, I'm gonna call the doctor. Okay. Hello? Dr. Green, hi, this is Ariana. I'm a nurse. I'm taking care of a patient in room 63A.
Okay.
The patient came in, she was in a fight, she has a black eye and some contusions, and I inspected her, I assessed her when she first came in, and all her vital signs, her level of consciousness, everything was normal. And then I came back 15 minutes later, and she felt very dizzy, and she was confused, and her pulse was 50 beats per minute, and her blood pressure was 150/90, and her pupils were no longer constricting when I shined the light in her eyes.
What meds is this patient on?
The patient is taking Coumadin.
Okay, you know what? I think the patient's having an acute subdural hematoma, so I'm going to be there right in like 20 minutes, okay?
Okay.
Thank you.
My name is Dr. Green. I'm your doctor for today. I'm going to make sure that you're doing okay, my dear?
Mom?
No, I'm Dr. Green, and you're in the hospital right now. Can you tell me your name?
George Washington.
Okay. So, Ariana, I want you to find out how much Coumadin she takes, and we're going to have to start some cardiopathic therapy. Also, I'm going to have you call the neurology team, and I'm also going to put in an order for CT scan stat. You can call and just check up on that. And I'm just going to need to also start an IV on her and put some hypertonic solution. Okay. Okay. So, Alyssa, so we think you have an acute subdural hematoma. So basically, we think that you have you're having almost a bleed out in your brain, and we want to make sure that that does not happen, alright? So I'm going to perform some of the same assessments that your nurse Ariana performed, and I know you feel sleepy, and I know you want to close your eyes. I'm tired. I know, my dear. I just need you to keep them open, so I'm going to be checking your pupils, okay? So if you could just stare up at the wall, I'm just going to get a light chance. Okay. And now I'm going to be testing your accommodation, so just continue staring, and then look at the tip of the pin. Okay, so I see that you're having some issues constricting, and that your accommodation, you're not quite, it's not good. Your pupils aren't constricting like in the technical term. Okay, and so now I'm going to be testing your motor function, so I'm going to put my fingers in between your hands, and you can just squeeze as much as you can. Okay, so I see that your strength is not that bad. You have more strength in your right arm. And now I'm going to be testing your lower extremities. So I'm going to have your feet like this. So my hands underneath your feet, and you can just press like you're pressing the gas pedal. Okay, and now up. And then if you can just press up. Okay, so again, so your motor strength is not bilateral, and I feel critical weakness on your left foot. And so I'm just going to I just want to check your level of consciousness. So if you can try saying your name again. More. Okay, and do you know where you are right now?
My house?
And do you know what year it is?
1995. May 31st, 1995.
visuals? No? Okay. Well, hang in there, kiddo. We're gonna take good care of you, alright? Okay. So I just got the CT scan back, and it shows that she does have a hematoma. So I'm going to schedule for an emergency surgery to remove it. For right now, we're going to hold off from Coumadin. Otherwise, great job, Ariana, in finding that, and good teamwork. Okay, I'm going to go see to my other patients.
Okay, awesome.
I'm going to go run.
You know what I'm saying? Happy. It's so nice to be happy. Everybody should be happy. It's so nice to be happy. Happy. It's so nice to be happy. It's so nice to be happy. It's so nice to be happy.